These days the treatment for heart attack has changed considerably over the past 10 to 20 years. The most important treatment we can offer once a patient gets to hospital is opening up that blocked artery so that we can restore blood flow and oxygen to the heart muscle. And we can dramatically reduce the amount of heart muscle damage if we get patients in early enough. So in some hospitals we have the availability of a 24-hour cardiac cath lab. So this means we'll take patients directly to the cath lab. We will put a tube into the groin and up into the heart, where we can actually put a wire and a balloon across that narrowing or blockage, open it up and put a stent in the artery to keep it open. So we can very quickly, often within 30 to 90 minutes after the patient arrives, get the artery open, establish flow and dramatically reduce the size of the heart attack. Now that service is really only available in big cities and some regional centres, but if you can get to hospital there are other options available as well, and this includes using clot-busting therapy, so using an intravenous drug to dissolve the clot in the artery, again opening up the artery and restoring flow to that damaged area. So these treatments really only work if they're given in the first few hours after a heart attack occurs. And that's why we say minutes means muscle. Every minute you delay results in more heart muscle damage. More heart muscle dies the longer you wait. So it's really important to get to hospital where you can be offered these treatments. After we've managed the acute event, there are a number of drugs which are used long-term to reduce the effects of the heart attack and to help reduce the risk of having another heart attack. The mainstay of treatment are antiplatelet drugs. These are drugs that are used to thin the blood to help flow through the coronary arteries. The most important of these is aspirin, and there are other blood-thinning drugs that we use as well. We also use cholesterol-lowering drugs to lower cholesterol because that has been shown to reduce the risk of heart attack in the future. There are many other groups of drugs that we also use, so it's very common for a patient when they initially go home from hospital after a heart attack to go home with perhaps 4 or 5 new drugs that they may not have had in the past. And some of these drugs will continue for about 12 months. Several of them will continue lifelong.